details for the webinar today. I always like to review the terminology. So the IVF process itself, and especially with any genetic testing that's going along with that, through IVF. I've listed a few examples here. These are not the only reasons to pursue PGTA, but these are just some of the common indications that we do see. One reason might be a maternal age of over 35 years old. We do know that as mom's age increases, the chance for having an aneuploidy or abnormal number of chromosomes does increase. So it may help with prioritizing the embryos in this process. Additionally, if you have a history of a previous pregnancy or a child that was born with a chromosome abnormality, it decreases the risk of miscarriage. And in general, it shortens the time to get pregnant. And what we mean by that is because you're choosing, when you transfer one embryo, you know that that embryo has the correct number of chromosomes, as opposed to perhaps unknowingly transferring an embryo that has an abnormal number of chromosomes, which would otherwise have either failed to implant or implanted but then resulted in an early miscarriage. With transferring a chromosomally normal embryo, it significantly increases the chance that it will implant and continue on in a pregnancy. We also can't test for traits like athleticism or intelligence. And then with the actual technology of the PGTA, we're really counting up the total number of whole chromosomes, and we can pick up those segmentals, like when we talked about the P and the Q letters next to the number. So those are really large pieces of chromosomes. So in general, the biopsy questions you can discuss with your IVF physician, but I do want to cover some specific points here. Embryo biopsy is not expected to cause birth defects. Typically, when we think about a risk for an embryo biopsy, it's usually the risk that the embryo might not survive that biopsy. This risk is expected to be very low, but you can also check with your IVF clinic because they may have specific numbers based on their experience. Typically, if this was the case, so if it was a scenario where the embryo didn't survive the biopsy or the thaw, you would know this before that embryo was even to be transferred. They may have all of the genetic information that they need, but it's rearranged a little bit differently. Common examples of this would be a translocation or inversion. So again, if there is a known risk for this, then PGT-SR would be indicated at the number of X and Y chromosomes. So important thing to think about, if that is information that you're hoping to get from the results, make sure you contact your physician to confirm what their policy is and that is something that's going to be reported to you and included with the testing for you. On the other hand, if it's something that you don't want to know, maybe you want to be surprised, you can also contact your physician and make sure that you guys are on the same page about that. If needed, iGenomics can mask that information on your report. Each embryo is going to be tested individually, so you'll see a result for each individual embryo. And like we mentioned earlier, that report will be sent to your physician and you'll discuss everything with them. Generally speaking, the main possible results that we would expect are either normal or euploid versus abnormal or aneuploid. With the euploid result, again, that's what we're hoping to find. That's what we know is going to give us the best chance for a successful outcome. With the aneuploid result, there can be some different types of this, which we'll go into a little bit more detail, but again, with the actual embryo result. So you'll see here we've got embryos 1, 4, and 5 that are euploid. That's great. Those are the ones we want to see. And we know those are the ones that are going to give you that best chance for the healthy baby. And then a couple of other different results for the other embryos. So embryo number 2 had complex aneuploidy. So we referred to that earlier. That means that it had between 2 and 5 different chromosomes involved. So this one was -7 and +19. The next embryo, number 3, was aneuploid, and you see a little letter next to the number of the chromosome. So this was -6q. If you see a letter, either Q or P, that's just referring to the portion of the chromosome. So for
Well, did you learn anything with the genetic counseling?
I was not present for most of it. My eyes are really dry, so I'm expressing my meibomian glands.
So we'll have to go back and review.
I know.
Basically, I learned how they take the cells from the embryo. They just do that, like some outside cells, and then send it to the lab to get it testing.
Yeah.
And really, they're only testing for chromosomal abnormalities, and that's really about it.
Okay. I did catch that she made a good point where some people argue you shouldn't do PGS testing because they may not survive the thaw. But if they're not going to survive the thaw for the PGS testing, they're not going to survive the thaw when you transfer them, and you'll be literally there for a transfer when that happens. That would be
It's a really good point.
sad. So
Yeah, it seems like the risks, like it's very, very, very minimal.
right, almost none.
And with being as cautious as Dr. Slowey, our reproductive endocrinologist, is, and he's suggesting that we do this,
Right.
then yeah, the risk has to be very, very low.
Right. Well, it also just helps us with decision making because we're still in the decision making process, which is interesting because when they send us the paperwork for like signing to do PGS testing, we also signed, or we're supposed to sign paperwork for a transfer, which I didn't sign because we're not doing a transfer.
They didn't even send that to me. I wonder if I don't have.
Like sending it to you was contingent upon me signing it.
Oh, okay.
So I don't think it would have sent to you unless I signed it, but I don't know why they keep thinking like we're doing. I guess probably most people don't get them genetically tested just to see.
Yeah, I don't know.
I don't know either.
I would say it's a crazy Friday night, but we actually did have a lot of fun.
Yeah, we did.
Hey, Bear, when you and I went on our date, where'd we go, buddy?
To get candy.
That's right, we went to the candy store. So we feel like Bear and Lyndle have been wanting some one-on-one time. So I took Bear to the candy store, and then we went to the arcade right next door.
An outdoor arcade.
It was an outdoor arcade. There was literally no other kids there. And there was literally nobody in the candy store. And then, Lyndle, what did you and Mommy do?
We go to the store.
You went to the store? What'd you get?
Salmon at the store.
You got salmon?
We also picked up dinner.
Poor kid. All right, Eloise, let me get you some more orange. Lyndle, you want to show the vlog your fingers? Oh,
So
I love it.
What did you pick out at the store?
I picked out fingernail polish.
How many colors?
2.
2.
And she picked a great.
Combination.
So she
there?
picked
Don't mind the beer.
girl after my own heart, an OPI color, which like if you're gonna go with a fingernail color that you just paint on, OPI is the best. Need some more.
Was it sour? Was that one sour? And then you got a sparkly one,
And
huh?
then a sparkly one that was
Sparkle. Sparkle.
Eloise say feather.
Do this one.
Feather. She can say feather?
She was afraid of it. She found a feather earlier and was like afraid of it.
That's awesome.
This one.
And then I showed her you can blow on it, so then she started.
Baba.
Eloise say dazzle.
Yeah, Eloise can literally say dazzle, but she can't walk yet.